Hello, everyone. My name is Trevor Vance. I am an occupational therapy student at Saginaw Valley State University, and this is a presentation on body dysmorphic disorder. It's commonly abbreviated BDD. So a little bit of table of contents and what to expect throughout this presentation. I will be talking about what exactly is body dysmorphic disorder. I'm going to talk about background information within this disorder. I'm going to talk about treatment options and occupational therapy's role within it. And I'll also be talking about community support options. What exactly is body dysmorphic disorder? DSM-5 criteria for meeting body dysmorphic disorder has four main criteria. The first one involves preoccupation with one or more perceived deficits or flaws in physical appearance that are not observable or appear slight to others. At some point during the course of the disorder, an individual has performed repetitive behaviors. Preoccupation causes clinically significant distress or impairment in social, occupational, or other areas of functioning. The apparent preoccupation is not better explained by body fat or weight in any individual whose symptoms meet diagnostic criteria for an eating disorder. Moving on, we're going to look at the incidence and prevalence of this disorder. So body dysmorphic disorder is a common disorder that is associated with a high rate of comorbidity and functional impairment. 2.4% of the United States population has this disorder. It is important to note that both sexes are equally affected and is associated with poor functioning and a chronic course. Frequently comorbid major disorders are such as depressive disorder, major depressive disorder, poor insight, social phobia, information processing disorders, eating disorders, and more. So a lot of these disorders that I just stated, body dysmorphic disorder individuals also have, or it stems from these other disorders. BDD is often misdiagnosed as an eating disorder if preoccupation is based on weight. And the mean age of onset is 16 years old for the disorder. So you can already tell that it's extremely important to start treatment options as soon as someone is diagnosed with this disorder for better outcomes. So a little bit about background information of body dysmorphic disorder. Talking about the etiology or the origin or cause of this disorder, the cause of this of BDD is multifactorial. So there are physical, emotional, and sexual abuse in childhood that often this disorder stems from and is caused by. BDD is also is considered a learned response and is caused from a learned response, such as people teasing you because of a body part. You often see this with children and adolescents throughout school, where people tease people based on what they wear or certain physical appearances. You also see cultural factors that cause this disorder, such as a different physical appearance standard between cultural, religious, and ethnic groups. There is a genetic component that may exist, but it is a much smaller contribution. It is not fully understood or studied. This disorder often stems from other disorders, as I said before, such as eating disorders. So for example, compulsive eating disorder often leads to gained weight or obesity. And then this individual would tend to focus on this gained weight, commonly in the stomach area, and then they would obsess over this imperfection, and then eventually body dysmorphic disorder would be diagnosed if they meet the criteria. So the psychophysiology of this disorder, it's important to note that there's very little known about the psychophysiology and pathophysiology of body dysmorphic disorder. Genetic factors likely play a role in the development of BDD, but little is known still. There are neurobiological substrates and abnormalities in information processes are starting to emerge. But as I said before, there is very little known about this. And recent studies claim that there is likely a complex interplay of dysfunction of brain networks that underlie body dysmorphic disorders. This includes frontal subcortical circuits, temporal and parietal lobe and limbic structures, possibly hemispheric imbalances, and others may produce the characteristic symptoms of BDD and neurocognitive deficits. But as I've been saying, there is very little known about the psychophysiology and pathophysiology of body dysmorphic disorder. So there is tons of room to grow and tons of more research that needs to be done. So the clinical course. how does this behavior how does this disorder behave over time? As I've been saying, body dysmorphic disorder is often misdiagnosed as other disorders or not diagnosed at all. BDD also follows a chronic course. Unless appropriate treatment is received, body dysmorphic disorder is a chronic disease, and treating it as soon as possible produces the best outcomes you can get. As I said before, the mean onset is 16 years old, and about 2.4% of the United States is diagnosed. This demonstrates the importance of education of a healthy body image among adolescents. As I refer back to my example before, and people getting teased in school because of certain imperfections on their body, it's important to have classes or have peers demonstrate to these students that it is okay to look different. And it's actually beautiful to look different. Everyone's beautiful in their own way. So education on a healthy body image is increasingly important and can help prevent body dysmorphic disorder before it gets too worse. So there are several symptoms, and the symptomology of body dysmorphic disorder is diverse. So this disorder causes severe emotional distress that leads to poor occupational performance and functioning. Some symptoms include anxiety, excessive worrying, poor life satisfaction, and quality of life. People with this disorder also have urges to get plastic surgery, dermatological treatment. Preoccupations with offending parts or these perceived deficits in individuals with this disorder may last 3 to 8 hours per day. So if you look at a day as in 24 hours, you sleep 8 hours a day, then you have 3 to 8 hours of repetitive behaviors such as constant mirror checking, excessive grooming, reassurance seeking, and camouflaging of the deficit with makeup, hair, and clothing. That is a lot of time throughout the day, and you can tell that work suffers, social life suffers, leisure suffers. You're basically worrying about your appearance all day, every day. So there is elevated social avoidance, both as a consequence and independent of BDD concerns. And moving on, some of the areas that are most commonly targeted by people with body dysmorphic disorder are the face, so your nose, eyes, lips, etc. They typically focus on the wrinkles, acne, how their face may be asymmetrical. So maybe their nose isn't straight, maybe their eyes are further away or higher up on one side, and other blemishes. Hair is also a main focal point, or a common area in this disorder, such as the hair's appearance, thinning, bald spots, etc. Skin is also a huge area that is most commonly targeted by people with body dysmorphic disorder. So this can include freckles on their skin, birthmarks, hair, small imperfections, acne. Skin is a huge area targeted. So people with this disorder also commonly target breast size, muscle size, legs, arms, stomach, thighs, etc. And the area targeted depends on the individual and their previous and past experiences. And it is important to know that there can be more than one perceived imperfection that someone with body dysmorphic disorder experiences. It's not just like they can have perceived their nose as being imperfection and also their hair, or it could just be their nose. It just depends on the person and their experiences. So the prognosis of body dysmorphic disorder usually presents a pattern of exacerbation and remission. There's also psychotic features and poor insight that are associated with a more chronic course. So this is a chronic disease, as I said before, so it will take a chronic course. Without proper treatment, the course of the disease is much worse. And as I said before, this is often misdiagnosed or not diagnosed at all, which means they aren't getting the treatment they need, which means the disease and the course of this disorder is much worse. It tends to get worse before it gets better, and it may lead to the development of other disorders, as I previously stated, such as eating disorders, OCD, and other mental health disorders. So the treatment options and an occupational therapy's role with this disorder is huge. An occupational therapist plays a huge role in the treatment if they get seen by an occupational therapist. So some general treatment options include cognitive behavioral therapy, that focuses on underlying attitudes in order for them to perceive their deficit in a different and more positive way. There's also coping and management skills, such as learning how to cope with the symptoms of anxiety and distress. For example, relaxation, meditation, mediation, and breathing techniques and exercises. This can all be done with the help of an occupational therapist. Keep that in mind. There's also pharmaceutical medications that you can take, such as antidepressants, SSRIs, and others that are commonly used to reduce BDD symptoms such as compulsive thoughts, depression, anxiety, and suicidal ideations. Moving on, there's also growing evidence that supports transdiagnostic, emotional-focused cognitive behavioral therapy. This type of CBT focuses on emotion regulation and the processes. So getting individuals' emotions in check and regulating them in a positive way. There's also psychotherapy, psychopharmaceutical intervention to reduce anxiety and stress, and also behavioral strategy and operant conditionings have been shown to help treat symptoms. Most individuals with body dysmorphic disorder do not receive an appropriate diagnosis, as I've been saying, or treatment, and treatment outcomes depend on the age of which you are diagnosed, symptom severity, and more. So occupational therapy's role with body dysmorphic disorder. The role of an occupational therapist is extremely valuable when treating body dysmorphic disorder. OTs help redirect energy and attention to more helpful occupational performance patterns. So instead of having an individual focus on the perceived deficit, occupational therapists will help transfer energy into other meaningful occupations in their life. OTs help reduce focus on perceived physical imperfections and increase focus on new interests, opportunities for meaningful social engagement, work, leisure, ADLs, IADLs, social interaction, and more. OTs perform direct practice through cognitive behavioral therapy and the use of role playing. So for instance, an occupational therapist would role play with this individual to get them either talking about their perceived deficit or taking their attention away from it and having them introduced into social settings to help get the client to realize that this is actually not an imperfection and to show them that they are beautiful in their own way. So OTs also perform less direct practice through group activities. This provides positive experiences and builds self-confidence in social settings. So you could, like as I said before, you can role play with 3 other people. You can just have group activity with other people, playing games or doing other kind of meaningful occupations or activities that just gets this client involved and socialized again. The role of an OT is seemingly endless. It just takes a lot of creativity and trial and error. And moving on, finally, we have community support options. So some community support groups are the International OCD Foundation for this disorder. You can find support groups online. I provided the website here. There's also Anxiety and Depression Association of America that holds online community support groups for body dysmorphic disorder. And then there's also Body Dysmorphic Disorder Foundation, the official one, and they hold support groups online or in person as well. You can also schedule meetings and talk to people there. I provide the website for all these. It's also important to note that friends, family members, and others of an individual suffering from body dysmorphic disorder can tremendously help support this person through this rough time in their life. These are my references. And to close, I hope you guys learned from this presentation and you take what you learned and apply it in your future endeavors. Thank you.